Welcome back, everyone. It's 12:54. You're watching CT Style. So it's summer upon us. Many of us are more aware of using sunblock and the risk of skin cancer.
Absolutely. And Dr. Sharon Christie, a dermatologist from Middlesex Hospital, along with Dr. Chachi Wang, a surgical oncologist, is here on CT Style. We want to welcome both of you here to the show, but it's very important. Obviously, summertime, heading on out to the beach. Sunscreen is very important. So what level should people be wearing?
So we recommend that all patients use a broad spectrum sunblock with SPF 30 or higher. So 30 is the lowest number.
Okay. And how about when it comes to different brands? Because you're in the supermarket and there's 80 different kinds.
I've even seen 100, SPF 100. Yeah. Does it get better the higher up you go or not? Doesn't matter?
Actually, after 30, it doesn't matter. The key is to reapply sunscreen every 2 hours.
2 hours, okay.
That's the important thing, not necessarily the brand name, but look for broad spectrum.
Okay, and do you wear it year-round?
You should wear sunscreen all the time on your face. We get a lot of incidental sun exposure as you're in the car, and so over time that adds up. And so we tend to see more skin cancers on the left side of the face.
Oh, wow, because of the
driving.
Yeah, driving in the car.
Yeah, I hear even on a cloudy day, you get 80% of the sun's rays, which is pretty incredible. But if it gets to the point where surgery or something does have to happen on some type of skin cancer, what should people look out for?
Right, so usually there's changing in the mole, which we can go over that, raises suspicions that whether this mole has potentially mutated to a cancer cell. So typically there's commonly found basal cell carcinoma, squamous cell carcinoma, and lastly there's melanoma also, which is potentially more severe skin cancer.
With some pictures up, that's the basal cell?
Yeah, so basal cells are the most common types of skin cancer.
Okay.
They're classified as non-melanoma skin cancer. So they're about 80% to 90% of skin cancers. And then those pictures are of melanoma. Melanoma is the least common, but the most deadly. It can be aggressive, can go inside the body. And that's where Dr. Wang kind of really plays an important role in cutting those out for me. Yeah. So I'll biopsy it and send those patients to Dr. Wang.
And how about people with a family history? Because that's pretty important as well, right?
Definitely. So early detection and prevention are actually very important. Family history does play a role. It is actually a risk factor for melanoma, in addition to being a fair skin or a history of easy sunburn. And these all play a factor of it. In addition, there is a subset of patients who may have family history of pancreatic cancer, in addition to multiple, what we call atypical mole syndromes. These folks probably want to talk to your doctor and think about a genetic counseling, because they may potentially put you on a higher risk to have other type of skin cancer.
But it is treatable.
It is definitely treatable, especially early detection. So surgery would be the primary treatment. Some people, such as about 5 to 10% of people, may present with more advanced disease. So in addition to surgical treatment, they might need what we call adjuvant therapy, which we will certainly talk more about this if patients being diagnosed with a higher stage of melanoma.
But just to repeat, it's very important to put on that sunblock, especially in the summer. We have so many people watching right now here on the shoreline in Connecticut, and here again are the 3 different types that we were discussing. But get out there, and you say 30 is really the max that you should be using, and every 2 hours is really the most important.
So even if it says it's water resistant, the key is you need to reapply it if you're around reflective surfaces like sand, water. In the wintertime around snow, you need to put it back on and look for that broad spectrum.
And how about tanning? That's
indoor tanning.
Indoor tanning,
right?
No-no,
okay.
Right?
No. So that's a big no-no, because indoor tanning has UVA light, and that penetrates deeper. And it also leads to skin cancer and photoaging. So people look older when they go tanning after a while.
Nobody wants that.
No.
So put a hat on too, right?
Absolutely. Use the hat with a very broad brim.
And it's so important for, I'm a mom of a 2-year-old, to keep that sunblock on the little guys as well, right?
Yes. So if they're younger than 6 months old, we recommend you keep them in the shade or use clothing. And once they're above 6 months, you start using, again, an SPF of 30.
Okay.
Reapply it often. And you know, kind of watch the levels.
Just be aware.
Be aware.
Very good.
All right. Well, wonderful advice there.
Yes,
Yeah, thank you guys so much.
Thank you for having us.
No doubt about it. All right, hey, tomorrow we are hanging out with our good friend Karen Thomas. She always has those etiquette tips.
Yeah, we're talking office etiquette tomorrow. You could get a few pointers, I think.
She's in the next cubicle over. She's always throwing paper airplanes over.
You yell a little bit too often.
Oh.
I'm just kidding.
Throwing punches over here. So guys, tune in tomorrow, CT Style. We'll be back at 12:30, and find us online. Just search CT Style. See you tomorrow.
Have a